training by a young generation, train the elderly on a regular basis to do with technology, how to use online services and order things and get doctor's appointment and, have family meetings and get into Facebook and Twitter, maybe even, to keep the mind and body occupied. And it's been a great help to them.
Lord Poppet, it's been an amazing afternoon. Thank you for sharing all your wonderful knowledge about the socio-economic impact of COVID-19 on our country, on the African subcontinent. So once again, on behalf of the Healing Our Earth team, we thank you very much for coming, giving us your valuable time and sharing some good knowledge with us. Thank you very much.
Thank you, Lalit. Thank you.
Thank you. Now, we are moving on from London. We are here once again, and it actually comes time for my hosting time to end. And I'm going to hand over my position at this moment to a lovely gentleman, Dr. Milind Shah from the United Kingdom. Let me tell you about Dr. Milind before he comes on board. He is an NHS doctor for many years, and he's a GP partner in a large practice in London, serving a variety of patients. He follows up a range of long-term patients from children to teens to adults with a particular interest in the elderly. This is just going on from our topic. We were talking with Lord Poppet, Dr. Milind, about how we're looking after the elderly people and the end-of-life care. From a spiritual background, the work is deemed as seva, service, with an emphasis on communication skills, with compassion and understanding. We have the next host coming up, Dr. Milind Shah, a super gentleman, a humble human being. Dr. Milind, welcome this afternoon to Healing Our Earth and on the COVID-19, the impact on the community. Good. A global namaste to you.
Global namaste. Thank you so much, Lalit. Dr. Sodak, a chiropractor. We're in a similar field, and it's good to see you again. And I really enjoyed that session with Lord Poppet. There was so much to pick up, particularly, as you mentioned, on the elderly. And it just came to mind, there's one very old, ancient Sanskrit saying, Matru Devo Bhava, Pitru Devo Bhava, Acharya Devo Bhava, Atiti Devo Bhava. Whoever you see, if you cannot see God, and everyone see God in your mother, in your father, in your teacher, whoever comes to you. And it particularly, I think in our field, whenever we see someone, at that point you see, may I offer that service? Whatever, at that point, those words, may they flow out of me at that time to help the other person. And particularly, I think, so welcome, I think you see behind me, welcome to a normal NHS general practice room. So I'm actually sitting in the surgery today on a Sunday, catching up with some work. And as Lord Poppet said, even particularly in Britain, things that the NHS had planned, namaste to you, Lord Poppet, as well. And on this day, there were things that were planned to take years ahead in terms of technology increase. I know one of our speakers is going to be speaking about technology. We've been doing as medics here, so online consultations, Zoom meetings, etc. But with that in mind, thank you so much for welcoming me on. And to all of you watching at home, there's so much more to see. So Dr. Sodha Lalit, before you leave us, maybe some highlights of what you've noticed. I mean, there was a session on Ayurveda, a session on nutrition, on economics, and also we had Master Del Pay with us as well.
Absolutely. I tell you, we've had an amazing morning this, when we started at noontime, actually, an amazing afternoon. We were in Canada with the Sri Ranjani Jaydev, who talked to us about Ayurveda and COVID. She talked about some amazing principles of Ayurveda and how we can prevent this COVID-19 affecting us. Then we flew on from Canada into the Philippines, and this amazing lady doctor, Dr. Michelle Palmer, she educated us on the right kind of food, on nutrition, and how we can build a strong immunity through nutrition. And moving on from there was Dr. Michelle Palmer's talk was absolutely amazing. And then came Master Del Pay, who is also from the Philippines, and mind-boggling how the online healing can affect people who have been affected with all kinds of diseases, and the concept of innate intelligence, the innate immunity, and how they can all work with you, provided they have the facilities online to actually heal the patients. And he's got some substantial work that he's done. So it was an amazing, and by ending my morning session with the lovely Lord Poppet, who was here talking about the socioeconomic impact of COVID on Britain. And we also traveled into a bit of Africa and looking at the economic status there. So once again, it has been a very, very informative session, Milan, and I'm sure the rest of the afternoon is going to be good. I'm going to say a very global, huge global namaste to all of you. Thank you for bearing with me this morning. It's been a great pleasure to be having hosted this event for Healing Our Earth. Thank you very much. Over to you, Dr. Milind Shah.
Thanks so much. So all of you watching at home, stay tuned. Lalit, thanks so much. I'm keeping my spine straight. All your guidance as well as a chiropractor. So keep well. And all of you watching, there is so much more to come. Do log in to Healing Our Earth, see who the speakers are coming up. So in a moment, we're going to introduce someone called Tushar Jalan, who's with us. So Tushar, a warm welcome. And in a moment, we're going to be introducing you. Please do look forward. We've got Dr. Harvey Patel, a dentist as well. Susanka Diaz talking about digital technology as well. So we've got, and also PK Narayan talking on economics as well. So we've got already in the next few hours, do look ahead of what's coming up. So just to remind you, Healing Our Earth is a community channel. Just do look, this is actually the 18th session. Every Sunday since almost COVID, the lockdown certainly in the UK began, this has become a global initiative. 18 sessions. So 18 is a very auspicious number in many ways. And this is our 18th session together. Every week as we continue, within the Indian community, the Hindu community, the festival of Janmashtami comes up. There'll be a very special Janmashtami session this Wednesday, the 12th of August. So do log in, find out what's happening there as well. And then we carry on next Sunday, the 16th of August, with another well-being session. So do look on, so many speakers have come and so many people have been sharing their wisdom, and we've learned from people we've otherwise never even connected with or known of. We've gone through this initial shock of COVID. And as you see, where are the epicenters now? We see South America, we see USA still cases rising, Africa and India. I think in Europe now, our resilience is trying to increase as the initial shock has come. How do we now take our next steps? In England, certainly it's the peak of summer at the moment. So we're seeing corona cases maybe being lower than before, but winter is coming and what changes those may bring. But anyways, we move on. Even Lord Poppet spoke about the elderly, and almost on the other side also of youth as well. What are the implications for youth and COVID? And for that, we're really happy to have our next speaker. So we'll see you online in a moment. Tushar, a warm welcome to Healing Our Earth. You're coming all the way from India at the moment. So a few words on who Tushar Jalan is. Tushar Jalan is a BBA, a Diploma of Marketing and Brand Management from Guwahati in Assam. So big welcome from India and Assam. Tushar runs his family business called Jalan's Tea. So hopefully you can share with us some tips on the best way of making a cup of tea. I think there are enough debates on that. In Europe, people don't add milk. In England, people add milk. But anyway, jokes apart, Tushar is also the founding president of Don Bosco Philately Club and a president of the Interactive Club of Don Bosco. And really a theme being of a youth change maker. I can see, do look up his biodata and write-up, but particularly on there of being a youth change maker. So with that in mind, hopefully there are some youth watching. The whole session is being recorded on YouTube and be ready to be played back. So even if those of you who missed a session, you can always go back. So Tushar, hopefully we'll now see you on the screen.
Yeah,
and
hello.
A warm welcome to you. So a namaste, and please do share with us, and we can share ideas and talk together. We've got for the next 25 minutes together, or as long as you want.
Sure. Thank you very much, Dr. Milind Shah, and a global namaste from India to all the participants of Healing Our Earth and the team Healing Our Earth. First of all, a thank you to Dr. Milind Shah, Mr. Neil, Mr. Jayashree Patel for your warm introduction. Today, I feel privileged and blessed to be invited by Team Healing Our Earth for the free global online summit on COVID community impact. And I would be speaking on role of youth in COVID era. So First of all, apologies. In the last moment, I had my uncle expired, so I had to run away from the funeral ground because my commitment is a commitment. So without wasting time, I'll share my screen so that we can begin audio visual one. Okay. Sorry.
Excellent, thank you. Yep, we can see your initial screen.
Sure. I think everything is visible, right?
Perfect. We can see your main screen.
Yeah. Okay. So please pardon me if anything is wrong because I'm in a hurry. Okay. So my topic is youth in COVID, and I am representing Rotaract District 3240, which is the 9 states, Indian states, which combines together, and it is known as Rotary International District 3190. I am sure that everybody have heard what Rotary is. We are very much responsible for ending polio in many countries. I think in Pakistan and Nigeria it is left, but we are sure that we would be ending there also. So my name is Tushar. I'm from Guwahati, Assam. So I would be speaking on youth in COVID. So here is a brief about my life. I born on 27 May in Guwahati in the Marwadi family. I've been educated in all the prestigious school of Northeast India, Maria Public School, Don Bosco, Faculty Amingao, Bangalore University. I own a company called Intercom Global, which is in branding, marketing, digital media, everything, and events. Also, we have a family business of Jalan Tea, which is 1979 brand, and we also hold the world's costliest tea record in the whole world. Also a startup called Absolute Tea. So these are all my past organizational experience from school, a president of Don Bosco Interact Club, founding Don Bosco Philately Club, co-member for Indian Red Cross Society, college, Rotaract, and Joy of Giving Week, etc. So let's move on. Here are some of the achievements we had in the Rotaract. Before going to the youth in COVID, I would like to give what Rotaract is. Rotaract, the organization which I represent, is the world's biggest youth organization, which is under the aegis of Rotary International, and it's a 53-year-old organization. So as you can see, the Rotaract Global News had featured our project, which was we had adopted a school and we had beautified without help of any person, professionals out there. Also, we have a project called Be for Her, in which happens in 5 countries. Till now, we have already educated and donated 11,000 rural girls, and we have donated around 1,50,000 sanitary pads with the education of how to use the pad, how to burn it after using, and what is the importance of the pad. Also, here is one more project, venture project chaired by me, which is transforming schools in Northeast. As a Rotary International Literacy Mission Chair of RID 3240, we ensured that 2 to 15 schools around Northeast got projects more than 5 lakh plus, which is self-funded by all the youth members of Rotaract. Here are some flagship projects under my chairmanship. We had launched Mukti, the anti-drug campaign, Up for Hope, Down for Dope. We have an initial target to create awareness and change 10,000 youths in a year. The project was launched by Honorable Governor of Assam, Professor Jagdish Mukhi, and on the right you can see Joint Commissioner of Police present there. As you can see, the same has been featured in this is a leaders gallery, the Chief Minister of Assam, Governor of Assam, and a life coach and a motivation speaker, Gaur Gopal Das. Rotarian Kalan Banerjee, who's a Rotary past international president, Rotarian Shekhar Mehta, who would be leading Rotary International in the year 2020-21. The Minister for Law, Justice, Cooperation and GTD, Siddharth Bhattacharjee, and Madhya Pradesh Chief Minister, Shivraj Singh Chauhan. So I think the drum beating has happened. Now let's focus on youth in COVID. So as we all know that from March, we all have been stuck in a very tight position called coronavirus or the COVID-19. So what is the definition of youth? We all know about the coronavirus or the COVID-19. What do you mean by the youth? The youth means the United Nations for Statistical defines youth as the persons between the age of 15 and 24. But unfortunately, in India, people of age 40 also consider themselves youth. So the line has to be drawn between the youth and an independent adult. I always believe in quote of great Swami Vivekananda, arise, awake, and stop not until the goal is reached. I have always one mantra for all the youth members of my organization, that you should be empowered by your mind, by the quality of the work, not the quantity of the work. So how are the youth of Rotaract 3240 are doing in 3240? Real life example which will inspire many. So let's go on the journey of Rotaract 3240 and 1500 plus youth who are doing selfless services to the society. So as we know that COVID has hit the world in a very bad way. So instead of wasting our time over Netflix, wasting our time over Prime Amazon or Hotstar or Sony Live or any other platform, our youth members from Rotaract, we decided to take up Rakshitam project, where it has been self-funded by the youth and more than 2 lakh rupees has been spent on 30 locations. On those 30 locations, we have distributed sanitizers, face shields and PPE kits to the policemen, the garbage pickers, the newspaper hawkers, nurses, ambulance worker, everything. So one might ask, this community service can be done by anybody. But the main difference is this is self-funded by the members. We don't get fund from any government or any NGO or anybody. So what is the benefit of the youth in doing this, and what are the advantages they are getting? First of all, productive time. Generally, we see that people, youth especially, waste their time in unwanted stuffs like drugs, like drinking, smoking, etc. whenever they are free. But we ensure that our volunteers do not waste their time, and every time of the lockdown, which they are at the home or their city, home city, they are doing a productive work. If you can see, there is a sense of mental peace and gratitude. You can see how we are empowering youth and making them understanding the hardships faced by policemen, the medical workers, and the garbage cleaners. We always, we youth have a tendency ki theek hai yaar, paisa, we are paying the money, but what I am paying it. So this all projects like Rakshitam and etc. realizes them, make them realize that they are doing a good job. And when they do the projects on ground, number one, it's a gratitude to all our hard workers who are in the front line as COVID warriors. Number two, they feel responsible. Number three, we serve the society on our capacity. So this makes the youth more responsible. Coming to Sanman. Sanman is felicitation of frontline Corona warriors with a small certificate which is framed. What is the benefit of a youth giving a certificate? Anybody can give a certificate. Today, the challenges come that, okay, if I go near any of the COVID frontline warrior, I will catch Corona, especially in India. But our youth, the Rotaractors, the RID 3240, under our leadership, they defy all the odds and they make sure that they hit the ground. They felicitate all the medical staff, all the garbage pickers, all the ambulance drivers, and they feel boosted up that if those people can serve, they can give their life for our nation, India, then why can't we? It's a real story which I told Jayashree ma'am also. Many people, the award receivers, it's a small certificate in 100 rupees frame. Many people cried. We are not able to show the video due to lack of time. but it's a real inspiration. We feel very good. So whenever a youth who is into bad things, I have seen in a real life example, 2-3 persons were there in Bangalore city when I was studying. So I was a part of this youth organization. They literally cried when they saw old age people in the old age homes when their children's abandoned them. So there comes the difference where youth organizations like Rotaract come into the play, and they make those unruly people, unruly youth, the youths which are in the wrong path, a life lesson that your life is not so free or not so, if I call in an Indian word, sasta nahi hai. So these are the few examples in which what you call our youths are doing that. Apart from that, our youths have been doing webinars on how to safeguard ourselves and the society and their family from COVID-19. They invite doctors from reputed hospitals and nursing homes and make sure that all the society members who are underprivileged, who do not get the opportunity to consult good doctors, get consultation for free. Webinars are organized on issues of mental health. As we can see in India and Mumbai, many stars have been suicidal. The cause, but suicide is a suicide. But our Rotaractors, the Rotaract P240, we have been doing multiple mental health and anti-suicide webinars during lockdown. As the report of WHO and the Health Ministry, the mental health of Indians or many other people around the world are going drastically down. So this is the point where our organization and my Rotaractors come to the play, and they ensure that nobody sits idle. Please trust me, I never get 1 minute time also in weekend. I think Jashi ma'am knows that. She had been following up with me, but I would have missed her communication, and I used to reply her after 2 to 3 days. That is the amount of time utilization this organization Rotaract has given. One more webinar or programs which our Rotaractors and we promote in our organization is number one, skilling up. We have webinars for free Photoshop. We have webinars for free Tally accounting softwares. We have webinars for different community services. We have webinars on public speaking. We have webinars on body language. All these are indirectly or directly affecting lives of many youths. You can imagine if an organization of 9 states, if they organize it, and in one go we have connected to 9 states youth, what a difference our organization is making. I would like to tell my story. What I was a shy boy. I was a very, like, if any guest used to come, I used to run away into my room, like, okay, mom, I don't want to meet anybody. But trust me, 7 years of Rotaraction, I am focusing on my organization Rotaract because this thing has taught me to earn my bread. This Rotaract has taught me how to talk. This organization has taught me human values. I can never forget this organization. So if I am mentally fit, if I am in front of you sparkling and speaking so much, trust me, during the lockdown days in India, we are locked down from March. But this organization has something or the other every day. I think those who see my status, Mr. Neil and Jayashi sees every day something or the other is there. So we make sure that our Rotaractors don't what you call sit idle, because you also know that idle minds are homes for devils. So what is the benefit of youth in Rotaract during our COVID times? Number one is better utilization of time instead of unethical work. Number two, I'm proud that Rotaract is present in 180 countries, and we have 250,000 members all around the world in 180 countries. And we have more than, I think, 7 to 8,000 clubs. So you can see, if you go to London, if you go to Australia, if you go to Bihar of India, if you go to Guwahati, Bangalore, Every nook and corner has a Rotarian. It has a Rotaractor. So you never have a lonely place to live. Wherever you go, we meet our members and we make sure that we connect to. There's a one real life story. 2 days back, a person in Dibrugarh needed plasma. So they searched the whole state of Assam, but they did not get the plasma. But my sister-in-law, that is my brother's wife, she is a COVID survivor. She made sure that upon my request, I connected her to that Rotaractor. And just see, his oxygen level was below 70. And 2 shots of plasma from my sister-in-law, and that youth is alive. They were ready to pay 1 lakh rupees for plasma due to shortage. But this platform during COVID saved a life. That is the power of Rotaract and its networking. We always think that we are lower than somebody. We always feel inferior. If somebody is better than us, we have a tendency, human nature, to get jealous. But please trust me, this organization treats everybody. If you are rich, if you are poor, if you are smart, if you are dumb, if you are good looking, if you're not, this organization never discriminates upon you. We have an extended family. As I told, that due to our Rotaract connections, the person got in touch with me, the youth got the plasma, he is out of danger. That is the extended family. I think we have, due to Rotaract, we were saving 100 lives, but this time we have saved a COVID affected person. So what is now, people will say, because this chap has promoted his Rotaract, okay, he came, but we don't need any introduction. We are a world brand of 53 years and Rotary is 114 years old, and we have honorary members like Ratan Tata, the Billas, the Godrej, and everybody. We don't need any platform to promote. But my motive is, if I go to Healing on Earth and if I promote myself, I would be doing injustice to an organization which has made me up. So the last point which I want to focus is all these things during COVID and non-COVID times. How does it make a youth better? When your circle is good, then obviously your thinking and your thought process would be good. Then lesser crimes would be there. Lesser unethical things would be there. People will indulge into networking. People will indulge into good community work. There would be less intake of drugs. There would be less suicide. There would be less unethical works and everything. When the world is adopting to the situation, our organization, Rotaract, we are making sure that you do not sit idle. They do not ruin themselves, and they become more responsible. They become more productive, and they become more sensible by better and effective utilization their time in a better way. And I would like to make sure that through your platform, we will promise that we would be soon tying up with Healing Your Earth on such good webinars where you promote good people around the world who is doing good. I think I have spoken a lot. If any questions are there, I'm open to it. And sorry for the, because as I told that I came from a funeral of my uncle. My commitment to Mr. Neil and my commitment to Jayashree ma'am was a commitment. I never backed down from my commitment. You can follow me on Facebook, TUSHARJLAN. I'm always there. And our organization is always there for such a great organization called Healing Our Earth. And I'm very grateful to the organizers for letting me express what we are doing during COVID in a very unprepared way, but due to unfortunate circumstances, we were not able to prepare. And thanks a lot for allowing me to present our work and myself in front of a global crowd of 40,000 as informed to me. Thank you. Global Namaste from India, Guwahati, Assam.
Fantastic. What a non-stop tour we just had from you. Really enjoyed that. And what is striking me from that is arise, awake, and stop not till your goal is reached. That quote from Swami Vivekananda, Uttishta Jagrata.
We always believe in that. And I personally, being a very big fan of Mr. Narendra Modi, our Honorable Prime Minister, I believe that our action speaks louder than words. And when odds are against that, we are stronger. If Corona is against us, we youth will defeat it like we have done. I would like to place 1, 2, 3 statistics. Many youth organizations are there in India, but I openly challenge from your platform to compare our two months work with theirs. Our Rotaractors are hitting the ground, but all youth organizations around the world, they are strict to webinars. And it's an unfortunate event that my uncle passed away and I was not able to show all the reports. If you can see, when people are giving the certificates to the ambulance workers, what in Hindi, I'll translate it to English. In Hindi, they said कि साहब बहुत लोग आए डॉक्टर को गमछा पहनाए, लेकिन हम जो पेशेंट को उसके घर में लाते हैं रात को 2 या 3 बजे, हमको कोई इज्जत ही नहीं करता. I would translate that in English for the global. When our Rotaractors, when the youth goes and felicitates with 100 rupees certificate in a frame, that ambulance driver which carries the COVID positive patient to home from home to the hospital, he always says that we have been working tirelessly from March, but nobody, all they come in a suit, they come into kurta pajama and everything. They felicitate all the good babus, the doctors, the higher officials, but they never look up to us. That is the value which we want our Rotaractors to learn, that to respect the lower class of people, due to which our India is performing better than many countries in fatality rate, in stopping the spread. So we don't only do community service, one platform for benefit, and the main thing is service above self. And we are proud Rotaractors, and I'm proud to say that I'm part of this from 7 years of Rotaractors, 3 years of interaction, and I'm sure I will be joining as a Rotarian. Thank you very much, and namaste.
Namaste. Thank you so much for your time, and to all of those who are watching. I think I've learned about Rotaract as well. Also, our condolences to your family member. Despite that, you came on as well. And what I'm taking away is this constant sense of dynamism. Don't let the mind remain idle. It can become a devil's workshop, particularly in youth. I'm also feeling old. 16 to 24 is youth. Oh dear, I'm definitely getting older then.
Please mind it. In our India, 40 years old uncle also understand that he's a youth, but I never understand that. I made sure that our membership age cap is up to 30. I told ठीक है 6 साल आप enjoy करिए, you enjoy for 6 years, but not more than 30. Sorry, you can join
okay.
That. No offense to anybody.
No, fair enough. I'm well past it then. But another quote from Swami Vivekananda, who said, I've met people who are 90 years young and 16 years old. And I think the theme there is about growing and serving. And you're right, at this time, particularly youth can feel as if everything is slowed down and there's no avenue for them to serve. So those youth who are watching, you're watching a replay of this, please do get involved in some service. What I'm also picking up is that when you do see others in a different position, your entire mindset is changed. I remember my first visit to a nursing home when I was a youth, my first visit to the homeless, and I'm sure Tushar will say the same. Your entire perspective is changed and you see life in its totality. So once again, on behalf of Healing Our Earth, dear Tushar Jalan, thank you for your time and sharing your ideas. Namaste.
Namaste. Thank you.
Good. So those who are watching at home, I really enjoyed that. I felt Tushar's real energy come through. So we're still going strong. We're right on track. And our next guest, really excited to welcome. I'm just reading through her description, and it's a warm welcome to Dr. Hari Patel, who is a dentist, a frontline medic, interning at the moment at Ahmedabad Municipal Corporation Hospital, but many other strings to her bow. So she's actually got her own creative startup called Paracosm, which is actually her drive is to revive or reinvent the excitement of handmade cards and letters, which is very nice to actually receive something handmade. And she's saying that in this current era of social media, to receive some handmade media is really exciting. So a warm welcome to you. I think you've done many other things, Harvi, including holding a diploma in Indian classical dance of Kathak. You're also a content writer, training to become a life coach as well. Gosh, how do you fit all this in? And as well as that, has been doing some online studying as well on psychological effects of COVID, art and medicine, creative thinking. Gosh, we have lots to learn from you, and a big welcome to Dr. Harvi, who will share some ideas. So a warm welcome to you. How are you getting on? Where are you broadcasting from at the moment?
Thank you. So yes, my name is Dr. Harvi Patel. Thank you, Dr. Milan, for this wonderful introduction that you gave. Right now, I'm at my hostel in the campus of Ahmedabad Municipal Corporation Hospital in Gujarat, that is in India. So yeah.
Brilliant. I can see some artwork behind you. Is that yours or one of your students or?
No, that's mine. That's mine.
Fantastic. So I think
Thank you.
you're now, we've got the next half an hour together. I'm sure you've prepared some things to share with us. There'll be some, we've got some questions for you as well on a medical theme, but also with your background in arts and the whole interaction, as you know, particularly those in the medical field, we know the interface between